So let's talk about two conditions you've definitely heard of: Alzheimer's and Parkinson's. They both attack our brain, which is, our most vital organ, but they do it in completely different ways. In this explainer, we're going to break down what makes them so different, look at how they're treated, and maybe most importantly, see why human connection can be the most powerful tool we have.
I mean, think about it. Our brain is everything, right? It's our memories, the way we move, our entire personality. So, what happens when something starts to go wrong in there? We're going to look at two of these neurodegenerative diseases, and while they're both incredibly tough, they target the brain in such different ways, which means really different journeys for the people living with them and their families.
Okay, so first up, let's tackle Alzheimer's. This is the one that most people immediately think of when they hear about memory loss, and for a really good reason. It's a disease that, bit by bit, kind of unravels a person's cognitive world. So, what's actually happening inside the brain? Well, it really boils down to two main culprits that are just creating chaos. First, you have these things called beta amyloid plaques. Think of them like sticky gunk that builds up between the brain cells, basically blocking the communication lines. At the same time, inside the cells, you get these twisted protein strands called tangles. They mess up the cell's internal transport system, so it can't get the nutrients it needs to survive.
And the result of all this chaos? It's pretty devastating. With all these disruptions, the neurons can't talk to each other anymore. They lose their connections, and eventually they just die off. This leads to what's called brain atrophy. The brain literally shrinks. And this damage is especially bad in areas that are crucial for memory, like the hippocampus.
This doesn't just happen overnight. It's a disease that unfolds over years. It often starts with what seems like pretty minor forgetfulness. Misplacing keys, forgetting names. But it keeps progressing, moving into more serious cognitive decline, and eventually reaching a late stage where a person needs complete help with every aspect of daily life. All right, now let's completely switch gears and talk about Parkinson's. And this is where you see a really sharp contrast. If you think of Alzheimer's as a thief of memory and thought, then Parkinson's is fundamentally a thief of movement. With Parkinson's, the problem is incredibly specific. It's all about the death of neurons in this tiny little area of the brain called the substantia nigra. Now, these specific cells have a super important job. They're the brain's main factory for dopamine. And dopamine is the chemical messenger that allows us to have smooth, controlled, coordinated movements.
Okay, this next part is just mind-blowing. The classic symptoms we think of with Parkinson's, like tremors, they often don't even show up until a staggering amount of damage has already been done. By the time they're noticeable, a person might have lost around 80% of those vital dopamine-producing cells. It just shows you how amazing the brain is at compensating, right up until it hits a tipping point. So if the symptoms show up so late, how do doctors recognize it? Well, to remember the classic motor symptoms, they often use a really simple but effective acronym: TRAP.
So what does TRAP stand for? Let's break it down. T is for tremor, that classic shaking, especially when the person's limb is just resting. R is for rigidity, a stiffness or increased muscle tone. A stands for akinesia or bradykinesia, which is just a technical way of saying movement is really slow or sometimes even absent. And finally, P is for postural instability, which leads to major problems with balance. And here's another interesting thing to know. Parkinson's doesn't affect everyone equally. Statistically, it's more common in men than in women by a ratio of about 3 to 2. Okay, so we've established that these two diseases have completely different causes. They're attacking the brain in totally different ways. So it makes sense that the playbooks for treating them are also completely different, right? Let's take a look. And this is probably the most important distinction when we talk about treatment. For Alzheimer's, sadly, there is still no cure. So the main goal of medications is to try and temporarily slow down that cognitive decline. But for Parkinson's, the strategy's way more direct. It's all about managing the symptoms by tackling that core problem, which is the lack of dopamine. This table gives us a great little snapshot of the drug strategies. For Alzheimer's, you've got meds that try to protect the brain's communication chemicals to slow down the damage. But with Parkinson's, it's all about dopamine, dopamine, dopamine. The main drug, levodopa, actually gives the brain the raw material it needs to make more dopamine itself. Other drugs try to mimic dopamine's effects. But medicine is really only one piece of the puzzle. For both of these diseases, compassionate, person-centered care is absolutely essential. It's what maintains dignity and quality of life. In fact, there's a whole toolbox of powerful strategies that have nothing to do with prescriptions, and they can make a world of difference, especially when it comes to managing difficult behaviors that can sometimes come with these conditions. And these techniques are so simple, but they can be incredibly effective. So instead of correcting someone, you could redirect them to a familiar, purposeful activity, like folding laundry or going for a walk. You can use distraction, put on their favorite song, offer them a snack, pull out an old photo album. Or you can just provide simple comfort, a gentle hand massage, a familiar scent, or a cozy blanket. And maybe the most important tool of all is how we communicate. Seriously, the right approach can build trust, it can de-escalate a tense situation, and it can help us connect with the person who is still there, behind the disease. So what does good communication look like? Well, first, you have to validate their feelings. Even if what they're saying isn't based in our reality, their feelings are 100% real. It means speaking slowly and clearly, using simple sentences, and just maintaining a calm, reassuring vibe. It's really about listening more than you talk. And just as crucial as what to do is knowing what not to do. This one is huge. Avoid arguing or trying to correct them. You will never win an argument with dementia, and all it does is make everyone more upset and confused. The goal isn't to be right, the goal is to connect. Ultimately, it all comes back to this one really powerful idea. A behavior that seems challenging or confusing, it isn't just a symptom. It's a form of communication. It's a signal that there's an unmet need. Maybe they're in pain, maybe they're hungry, maybe they're scared, or maybe they're just lonely. So the real question isn't, how do we stop this behavior? The question is, what is this person trying to tell us? And when you start asking that question, well, that changes everything.